Hey everyone, still taking it easy, and now we're going to demonstrate suctioning.
Suctioning, which is the most probably unwanted and traumatic thing that we have to do,
But necessary.
but necessary for Evan to get the secretions out. Sometimes coughing just doesn't quite do the trick, so we have to suction those secretions out. This is a suction machine that you can see down here. It's got a simple on-off button here on the end. It's got a suction tubing here and a canister into which the secretions come. Now, this is, as I described earlier, this is his suction catheter. And you can see where it goes. This is an old one that I'm holding here. It goes kind of like this over his trach, and you can see how that one is attached. And this just fits on the end of it, like so. Nothing complicated about that. And the whole point of this, as you can hopefully see, is inside of this cellophane, which is just there to keep the catheter itself sterile, is the catheter. And you can see it coming up. And of course, I would never touch this if we're going inside of his trachea. But you can see that that this goes up. We push it up, and it goes down through his trach and into his trachea and right toward the top of his lungs. And in the end, you can see that there are some holes, and when it's on, suctioning will happen through these holes and withdraw whatever secretions are in his trachea. Let's see here. What else do I need to say about that? The button. There's a button here at the bottom. When you press the button, it's allowing the suctioning to take place. Now, before I suction Evan, I'm going to sort of demonstrate something. When we suction Evan, I don't guess I need that on because it's just noise. But when we suction Evan, we press the button the whole way. I kind of hold this like because it's going to be a fixed point. But we press the button the whole way we're pressing it down. So it's suctioning all the way down and all the way up. And the simple reason why we do that is because we don't want to just push it down there without it suctioning, because all this catheter is doing is pushing the secretions down into his lungs, and we're not looking, actually we're too high, and we don't want to push them down. We want to suck them out as we go down. So we're pressing the button all the way down and then all the way up. And you can generally tell whether you're getting something by two ways. Number one, this is an opaque tube, and so you can see if any secretions are coming in. But there's also some vibration, usually some subtle vibration when you're actually getting some secretions out. Now, one thing to be careful of in doing this is, although the length of this is purposed to approximate the length from here on his trach. From here on his trach to the top of his lungs, where the trachea ends and branches out into his two lungs. When you're pressing this down, after you've done it a couple of times, you'll notice about an inch before you get to the end, you're meeting some resistance. And the resistance that you're meeting is where the trachea ends and you're going to the branch to his lungs. And you want to be careful there because it can cause some trauma to his lungs. It's not life-threatening trauma or anything like that. It just hurts. And you want to be careful maybe not to press the button for that last inch or so, because it can actually suction tissue on the lungs. And it'll heal, but again, it's just very uncomfortable for Evan, and it causes some pain. So for the most part, this catheter can go all the way down, but be very gentle for the last inch. You can tell when you hit resistance, and when you hit that resistance, before you press that button again, pull back just a fraction, so it's not suctioning actually while it's attached to the lung. Now hopefully that all makes sense. Now for this, his balloon can be either up or down. It doesn't matter. We usually keep it deflated so he can talk to us and so forth. And so now, having talked about it, we're actually going to do it, and you can see how it's accomplished. I'm going to turn it on.
It comes with a safety cap.
Yeah, this got a simple blue safety cap on there, and you can just pull that off. And actually, it doesn't really serve any purpose once it's in place. But anyway, the suction, the line is now attached to his catheter, and at this point, I'm going to use my I'm going to press the button with my right hand, and I'm going to push it down with the left. And you can see that it's traumatic for him. It's not enjoyable at all. But maybe you can see, and maybe you can't. I think you can. The amount of secretions that came up. Now this is over and above what came up when we coughed a few moments ago, and so we a lot of times have to do both of them, and a lot of times we cycle back and forth, suctioning, coughing, and coughing, and you can see why it would not be a pleasurable experience. It's kind of it's the most traumatizing thing that we do as a part of Evan's daily therapy. And we try to keep this line here clear. In our case, we've got a canister over here beside his suction machine. We just run water through it. It doesn't have to be sterile water or anything. Just to clear the line out. And here's a canister that's filled with secretions. And when that gets close to full, obviously we rinse it out and so just replace it. What am I skipping here, Evan? One other thing that I will say, when you're suctioning Evan, or anybody, I guess, when you're running this line down, you have to be slow and deliberate, but not too deliberate, because after about 6 or 7 seconds, well, let's put it this way. When this line is inserted in his trachea, he's obviously not able to breathe much because the line itself is filling the trachea, and so there's no way for air to get down there. And not only because of the line itself filling the trachea, but also you're suctioning, so you're continually pulling air out, so no air can come in. So be deliberate enough to get the secretions out, but after 6 or 7 seconds, this should be done, because if it's not, he'll need to take a breath. Anything else about suctioning that I've missed, Evan?
Nope, it sucks.
It does suck. It's a terrible thing. Now something that we do periodically, and while this video is going, I'll talk about it. These saline bullets, as we are prone to call them, occasionally during the day, his secretions will be very thick, and you can usually tell that when you run the catheter down. If it doesn't slide down easily, if it kind of feels like you're pushing it through sludge, it probably means that the secretions are kind of thick. What we do sometimes is we put some saline in. Now this will only work, by the way, with the help of gravity, so Evan would have to tilt back. But one of these bullets is put right here, and then once he's tilted back so that this assembly is in an upward position rather than down like it is now, then you just squeeze this little ampule of saline in, and he will cough vigorously when that enters his trachea and down in his lungs. And then after 3 or 4 seconds, you just do the suctioning process or coughing process to help those secretions that hopefully have been thinned out by the saline to come out. So that's, I think, about it for suctioning. Maybe I've already said it, but if not, I'll say it again. We do this every day throughout the day. I'd say 15 to 25 times, depending on circumstances throughout the day. And again, Evan can tell you when he needs to be suctioned, and usually can differentiate when he needs to be suctioned as opposed to coughing. And a lot of times they have to be done in tandem. I think that's about it for suctioning. So that's 4 pieces of equipment that we've gone over: the vest, the nebulizer, the cough assist machine, and the suction machine. And we'll talk more later.